Good morning, Mobile, and all of our friends along the Gulf Coast. Thank you again for joining us for another episode of the EchoStop Live podcast. We are here continuing our series on voices in the community. I'm Kevin, back with my good friend Curtis. Curtis?
Hey, what's going on? How are you?
I'm great, Curtis. I've got a surprise for you today, though. Yes, I do have a surprise for you today.
What's the surprise?
We are not alone once again. I'm
going to play along with it.
Well, you should. But it truly takes many voices in the community, and I'm absolutely honored to have Dr. Williams with us today, who not only has a busy schedule, but also is passionate about what it is that drives us to even do this podcast. And we're going to hear about a program that she's created. And so when we bring all these things together, our hope is that our viewers see, learn, and understand that 24/7 we are trying to find unique and creative ways to make this place safer and as beautiful as it can be. But without further ado, Dr. Williams, tell us a little bit about yourself so our audience can learn a little bit about who you are.
Yes, thank you. I'm Dr. Ashley Williams. I'm a trauma surgeon at USA Health. I've been here for just over a year as an attending, but certainly have done training in this area and have been here overall since 2015. Certainly in my job, I see the impact of gun violence every single day. And so I'm super excited to talk about this and new innovative ideas that we have and ways we can work together.
That's awesome. And, a lot of people are probably thinking, a lot of people.
A lot of people, I don't know. Okay. Well, let's go with it.
We've had different guests on our show who represent different sectors of the workplace, if you will. And when you have a physician on your show, I think the immediate thought is, and a trauma surgeon nonetheless, your immediate thought is, okay, it's specifically the 2 + 2 is 4. Like, well, this must be somebody that works on somebody in an operating room in a hospital, but the behind the scenes caring that goes into preventing those people from getting wheeled in the doors. That's the effort of what we're really going to spend some time on talking about.
Yeah, I totally agree with, we played around a little bit earlier, but, the work that's being done at the hospital is very serious work. Stuff being done out in the field is very serious work. You are right there at the center of all of that, especially when things happen that we're trying to prevent. And you're seeing the worst in those cases. And I know your heart is in it because I've known you for years now. And I know the work that you do and the work you do behind the scenes. So I'm appreciative of you being here and the work that you do for our city.
I think impact is important. And we know, obviously, you play a significant role in dealing with the impact. We've had some other guests on in the past, and we've asked questions, and we're like, hey, this isn't just a conversation, but there's emotion. If somebody gets hurt or even worse, killed, there's emotion. There's tolls on the family and the communities. And so I wanted just to spend a second and just kind of let you illustrate without getting too graphic. But, a trauma injury from gunshot wound, this isn't just something that happens. Somebody comes in the hospital, they get treated, and they get well. Like, there's long-standing, significant things. So tell us a little bit about that so that people understand the magnitude of what we're really talking about.
Yeah. So certainly, we are trained to deal with any type of injury, from a medical standpoint. We've gotten really good at that. Part of my passion and part of what I want to bring to the table is really the holistic care of a patient. We're not just treating a patient who was shot. We're treating that patient, we're caring for them, but we're also taking care of their family as well. They're not the only ones that are affected by that gunshot wound. Certainly when they first come in, it's all about making sure that we're caring for their injury and making sure that we are doing everything we can to preserve their life, but also preserve their function. Certainly, we have all the numbers of there are this many gunshots, a year in the country, in Alabama, in our city, and this number of people die from it. But what we don't really have a good grasp on is the whole impact of gun violence. We don't talk enough about what it's like for that patient who survives the gunshot wound to then get better. And being in the hospital is only a piece of it. We like to say a lot of the recovery comes after they leave the hospital. And so when you begin to take care of that patient, you have to understand, okay, what resources does this patient have for when they are home after, having something like this happen, when they do make it out of the hospital, what resources do they have to care for themselves? Do they have family members, friends, that support system to be able to finish recovering? And on top of the physical injury, what impact does this have on them emotionally, psychologically, spiritually? And so thinking about trauma in a holistic way is really my passion and kind of what I bring to the table in terms of how we're caring for these patients.
And Curtis, I know we've had this conversation before, but when that one incident occurs, and there's a shooting, because we're talking about gun violence for just a minute here. And if we're talking about gun violence when that incident occurs, I see about one of maybe three options, and I'm sure there's others, so I don't want to limit. But, a victim comes in with a gunshot wound and recovers healthily, returns back to a normal life, and there's no trauma, okay? I find that one to be the least likely because if you sustain a traumatic injury, there's trauma. But let's just say that's one option. The other option is they come in as a victim and they leave with a victim mentality. The third option is they come in as a victim and they leave with an offender mentality because now there's a retaliation or somebody did something to me. All of the root causes of that and all of the other possibilities are out there. And I know you have programs that you're working with. Project Inspire obviously is a key program in the community. What things can be done to find out how a person is thinking about their situation? And that could change, right? 3 months later, they could have a different mindset. And what kind of programs, what long-term things are being looked at, whether they exist now or not in the future, that deal with that so that we don't have people reoffend, become an offender, or just live a closet life as a victim because of this traumatic incident that's occurred?
I think, and Dr. Williams will echo this, I'm sure, is that we in the city of Mobile, we've done some extraordinary things in trying to strengthen collaboration. We've been collaborating behind the scenes for years now, often without the resources to do the best collaboration. But we've figured out how to accomplish a lot with little. And that's from leveraging one another's resources, helping one another, because you hear me talk about the common denominator all the time, and that is the youth are people who are impacted by trauma. That's the common denominator, because we know, in essence, if we do not come up with strategies to holistically address that family or that individual, that we won't see the last of it.
And what are your thoughts on, you talk about this holistic approach, which we love. We've identified four corners in sort of Operation Echo Stop,
right.
Project Inspire. I know we've talked briefly about it in the past. And so there's sort of the same idea as we're going to approach it from every single possible angle that we know of right now, and we may learn of more in the future.
Right.
That seems like a pretty tedious process, but what are the benefits of taking a holistic approach?
Yeah, it's certainly a tedious process, and it's certainly resource intensive. The way I think about injury and how to really prevent it from ever happening, we really have to be intentional about looking at and identifying and addressing the social determinants of health. Mm-hmm. So the same things that put our patients at risk for diabetes, hypertension, and the list goes on, cancer even, are the same things that put our patients at risk for injury. And so how do we really become intentional about looking at what those factors are that are unique to our community, and how can we change systems and how can we change infrastructure to be able to support our patients after we've identified those needs, being able to support them with those needs.
You just said something when you referenced and you compared violence to that of someone being treated for an illness, whether it be diabetes or whatever. The difference, I think, is that with a individual health issue, it remains that way outside of the family supporting that person through their process of healing. But with violence metastasizes outside of the body itself. The one person who may have been impacted by the trauma, the gunshot wound, oftentimes, if untreated, others become also infected by that same violence.
Yes, and you use the term infected, and that's exactly where my mind went when you think about an infectious disease process. Certainly with the HIV pandemic, we've made lots of headway because we tackled that problem from a public health approach because we used all sectors of society to work together in collaboration to come up with solutions. And I think that is extremely important in gun violence, is that what you mentioned, we can no longer work in silos, but we must work together to really be intentional about pooling our resources, pooling all of our ideas, and really seeing them to fruition.
And I think working together really kind of takes us to a quick segue where we're going to talk about what Echo Stop Live podcast can do in the community. Why are we bringing guests on our show that are instrumental in forwarding the effort, the parallel effort of many different programs? It's not just Echo Stop. There's a lot of things happening in the community. And so we don't just keep the branding in-house. We're trying to show you as a viewer how you can come alongside us and participate just as we want to come alongside you and make this community better. One of the things you can do is send tips anonymously to our tip line. We have an anonymous tip line. It's 844-251-0644. It's 844-251-0644. And you can send us a text. You can give us a call. And we've seen tremendous impact just from participation. The community outreach that we've seen in people who are wanting to find ways to engage with their own community to keep it safe has been phenomenal. Also, we are looking forward to receiving emails from you if you have a suggestion or if you have a comment or if you want to even ask a question. We'll try to get to one question a show if we can. And that's echostoplive@gmail.com, echostoplive@gmail.com. But before we go any further, I want to stop for just a minute and let you all reflect for just a second on this video about Project Inspire.
Call it. I never want to have to tell another parent that I could not save their child.
As professionals in the medical field, we've come to learn that the best way to treat any disease is to prevent it from ever happening. Violence is a disease that's attacking our youth.
And it needs to be treated immediately. How do we do that?
Through building confidence. Right here we have the gallbladder.
Through educational and professional development.
Through teaching financial literacy.
Through mentoring future professionals. Through Project Inspire.
We utilize the hospital as a venue to build lasting relationships with teenagers at risk, to help unlock the abundance of potential that's hidden beneath the surface.
Project Inspire.
If we inspire one,
We've inspired many.
Welcome back. We're glad you took a moment to view that very impressive video. So you guys are doing some great work.
Thank you.
Talk about some success stories. Tell us about some of the things that you're seeing already, even in the short time that you're just kind of pumped up about.
Yeah. So Project Inspire is certainly one of my passion projects. I think it's super important to be able to take care of patients inside the hospital, but really being able to branch out of the hospital walls and really focus on that preventive piece, I think, is key. This is one of the rare programs around the country that reach outside of the patient population in terms of gun violence intervention, but really going into the community and working with community dwelling teenagers. So I'm really proud of this project, and I think we have had great success stories. We started in 2018 and have had 3 classes since. We didn't during the pandemic. Our last class just graduated December of this past year, so just over a month ago. Certainly, we are looking at rate of recidivism. So the goal is to keep kids out of jail. And we've had great success. Thus far, we've only had 1 child reoffend. And certainly we're always thinking about how do we not lose that 1 child? How do we continue to change our program and adapt to the point where we're losing no children?
And I'm hearing something. I'm throwing this one to you because you're thinking the same thing I am. I'm pretty sure.
Yeah, you know I am.
But
the value of one.
We've had this one in the 99 conversation for a while. But what I also am hearing you say, which ties directly into what you were just saying, is we're not. I mean, we have a medical doctor, a physician, a specialist in her own field who's talking about preventing juveniles from becoming recidivist and reducing the population. So what I'm hearing is earlier you said saving lives and preserving abilities. What I'm really hearing is saving lives and inspiring capabilities.
Let me give you
because
an
that's where we're going, right?
And I'll give you an example. I'll speak on what I've seen Dr. Williams do in the community with Project Inspire. They take youth who others will not take the time to work with, those who've been impacted by violence, the one. Okay, oftentimes that one who may have been behind creating some of the problems that he or she is now dealing with. But what they do is that they instill value in that one. They take them and show them the value that they have in them that goes beyond just the number one. And what they do is they don't just tell them, they show them. And the results that I've seen them have in their program is nothing short of outstanding.
Can we all say this publicly? Can we agree? And you don't have to agree. Curtis needs to, but no. Can we all? And honestly, I want to say this publicly. I want to put this out there to the entire audience and population. I hope this gets forwarded around the world. But no one is worthless. Correct?
No, not at all.
Okay, so everybody has value,
right?
Even if they've gotten themselves into a situation.
100%.
There's more to the story. How did that situation even manifest itself to that point to which you have to make contact, right? Did somebody miss something along the way? Is it a generational issue? We go back to the four corners, which we'll have a whole separate episode on, but, I highlight this all the time, not just of EchoStop, but of society. You've got faith, family, education, and government. When any one of those pillars is missing, the system is broken, and it's just a matter of time before the train goes off the rails.
Absolutely.
And so you see the end result of this in many, unfortunately.
Right.
And so is that part of this holistic approach that you guys are looking at?
Absolutely. Again, my brain is medically driven and disease process driven. And so when you think about all of the health issues that we deal with, the best way to treat it is to prevent it. So how do we keep patients? If I could put myself out of a job, that'd be great. Because, having that same conversation of, this has happened, speaking with a mother or a father, this has happened to your child. I'm sorry this has happened. Despite us being able to do everything we can, either your child didn't make it or they're not going to be the same as they were before this happened. And so if I can stop having that conversation, that is my goal. Because like you said,
because
everybody
that's not an easy conversation. Let's just be real. No matter how many times you do that, we say this in law enforcement. You may show up to 911 calls 100 times a day, but each one of those represents somebody's worst day.
Exactly.
You're experiencing the exact same thing.
Exactly.
And I think one of the things that we have to realize as well is that when that one does not feel like they have value, they feel less than. And those who don't feel value in themselves, how can they see value in others? And so when we fail to do those things that Project Inspire does, what happens is we get the things that we see on the 6 o'clock news, on the 10 o'clock news, where someone who felt no value in themselves decided to devalue others as well.
Right. And you see it in the program. I mean, when the kids first get there, of course, they're wondering, why am I here? What is this for? And you kind of see those walls as expected. But man, even from the first day, you really start to see those walls come down, those barriers start coming down. They open up to you and you see them no longer as, coming from where they came from or have done what they've done, but you see them as kids. And I think the beauty in Project Inspire is we give them a space where they can just be kids. And I think that goes a long way with them. And we see it all the time. You can't crunch numbers and get this sort of impact,
Right.
But when they come to you and they ask, can I be in the program again next semester? Or, how do I continue to be involved? Or, man, I'm upset that this is over. Like, I don't feel right. Why is this over? You know that you're doing something positive.
Well, and that's the driving of the outcome, right, versus the output. So we're not just pushing out numbers, we're pushing out outcome. People want to know, how did you prevent a crime that nobody ever knew was going to exist? There's no way to measure that.
Right.
But aren't we just a little bit safer? Isn't the community just a little bit better? So we're winding down this podcast, unfortunately. And just like the ones involved in the program, I'm kind of upset that this is coming to an end. So I want to give you an open invitation to come back whenever your schedule permits, because we have a lot more to talk about. But I have two points that I kind of just want to raise as we wind down. And I want to remind everybody to tune in on Fridays at 8:30 in the morning to EchoStop Live podcast. We're on YouTube, Facebook, and you can send us your email at echostoplive@gmail.com. But before we leave, the target audience here are obviously that group of people within our community, including ourselves, that can do something. So I really had 2 questions, and I'll ask them, and you don't have to answer them in one sentence. But how do people get involved from outside the medical community? So if there's just citizens that have been looking, we get emails all the time from people who are like, "What can I do?" And then, from sort of a child, I'm a child at heart, and I always like to ask why, because that's what kids do. They ask why. Why do you do what you do? Those are my questions. So, why do you do what you do, and how does someone get involved?
Perfect. I think I can answer both. In terms of how do you get involved, I mentioned that we're always thinking about how do we prevent that one. And so that has driven, I think, 2 very valuable partnerships. We have many, and they're all important. So I don't want to make it seem like that. But 2 of the newest ones are, one, we have a partnership now with Bishop State. I think that they are key, because when our kids come to us, they come with ability, they come with capabilities and skill sets, and it's just a matter of bridging the gap.
Right.
And I think Bishop State plays a huge role in that, because they are an institution right in our community that offers a enormous amount of programs that our kids can participate in. They're not all medically driven. They don't all want to go into the medical field. But if we can plug them in with what they desire to do or what they have the skill set to do, then we want to do that for them while they're with us. And the other key piece is we've partnered with Big Brothers, Big Sisters.
That's great.
Because I think, so when our kid reoffended, it was 2 years after the program. And so how can we continue that mentorship? How can we continue that child having someone, to be able to call upon in their time of need? And so the plan moving forward is that Big Brother, Big Sister would fill that gap for us.
That's awesome.
And being able to have, that continuity of care, as we would say in the medical field. So certainly we are always looking for mentors, and you don't have to look like the kids. You don't have to talk like the kids. They just want somebody who cares about them and who has a genuine heart. And I think, anybody in the community who cares about kids and has a genuine heart can help in terms of either coming and talking about your experiences, coming and talk about what you do and how you got to where you are, or becoming a mentor for our kids.
That's amazing. And last, as we close out, Curtis, you're going to get the last word, but the second to last word as we close out, if you had to in 30 seconds, what would you tell our audience why? What drives you to do what you do?
Yes, certainly it's our future. I think, we are not individuals, so to speak. We're a community. And I think if you don't take care of the least of us, then none of us are taken care of. So I think it's super important for people to begin looking at each other as people and really understanding that we're all in this together. There are lots of things that can divide us, but the thing that brings us all together is we're a community, we're one. And I think as we rise, we got to pull those who need us to pull up with us.
That's awesome. I think the more people realize the least of these are the people that we associate with. They're the people that we work with. They're the people we live with, the people we shop with, in the community with.
Absolutely.
I think that's awesome that you said that. Well, we are out of time, so we're going to be ending this podcast. We wish you safety. I will be praying a prayer of protection around the work that you do in your program, because I think it is that important in our community. Curtis, if you want to close us out with any thoughts, you can, because we're about to wind this down and send our audience to the rest of their Friday.
Last word is actually really just more of a challenge. We sit here and we talk today about the things that Dr. Williams is doing as a trauma surgeon. Now, her time is not hers. Her time is pretty much occupied with a lot of different life-saving needs. So if she can find time to inspire others, my challenge to our audience is, what can you do to inspire others?
That's great. Think about that. Join us every Friday at 8:30. We'd love to help plug you in. And if you're not sure and you just want to help, send us an email. We'll connect you with the doctor and her program, or any of the other programs that are most appropriate. We want to be a conduit for that, not just a broadcaster of that. But thanks again for joining in. We'll see you next Friday at 8:30. And until then, be safe. And it takes all of us, so be part of the solution. And we appreciate your tuning in. Have a great Friday.